Hello, everyone, and welcome to this audio podcast. In this audio podcast series, the LabTronix series. This is the Shientist, and today I'm gonna be providing an overview regarding renal and infections. This is a collaborative between the RPSG and KDARS. It's an RPSG and KDARS collaborative, and this is part of the Ballistix Edition, and part of being part of the Ballistix Edition. This is another Storm Robotics production. So to begin with, I'm going to talk a little bit about hepatitis C virus, or HCV infection in chronic kidney disease, or CKD. So CKD patients can have a higher prevalence of HCV infection compared with the general population, and HCV-infected CKD patients with accelerated rate of renal function decline, and an increase of have an increased risk of progressing into end-stage renal disease, or ESRD. Infection with HCV has been implicated as being causative in most patients with what is referred to as mixed cryoglobulinemia, where there's a sort of a discoloration around the skin, and this can prompt several histological forms of glomerular injury in turn as well. There's works by Ladino et al. And team from 2016. The HCV in patients with ESRD, end-stage renal disease, has been exceeded that of has been evidenced that it has exceeded the that of the general population in some contexts, and transmission of the virus has been evident in patients who may be undergoing forms of renal replacement therapy. And so the risk of transmission is an ongoing has been an ongoing sort of hazard, and an increased number of cases where there's been acute HCV infection events amongst patients undergoing for example, hemodialysis as a form of renal replacement therapy. And again, Ladino and team highlight this from 2016. Now, in context of prevention around HCV, the precautions, some precautions have been made and identified at particular renal replacement therapy clinics, emphasizing the need for continuously improving infection control practices and environmental disinfection procedures, accompanied by adherence to recommend Centers for Disease and Control and Prevention (CDC) HCV screening procedures. Investigations have identified that HCV infection is associated with with an increased mortality in patients with ESRD, and transplanting an anti-HCV positive patient with ESRD, transplanting an anti-HCV positive patient with ESRD is accompanied by significantly decreased risk of death compared with those remaining on the waiting list. HCV infected renal patients have an increased hazard ratio for death, and transplant continues to offer these patients a significantly improved survival compared with those remaining on a form of renal replacement therapy. At the same time, HCV is known to be a systemic disease with important extra hepatic consequences. HCV infection is one of the primary causes of liver disease in those patients who have been who've been transplanted. For example, HCV infected recipients are at increased risk of recurrent membrane HCV infected recipients are at increased risk of recurrent membranous nephropathy and transplant glomerulopathy, and at least in those patients who have been diagnosed with specific forms of renal disease as a preemptive disposition. I'm now gonna talk a little bit about methicillin-resistant Staphylococcus aureus, or MRSA. So MRSA, bloodstream infection, also known as BSI, has a major concern throughout healthcare, and due to its high incident rates. And the vascular access, wherein patients may have a form of vascular access, can usually be a frequent source for MRSA BSI. And there's works by Cavero and team in 2015 that highlight this. Hemodialysis patients, especially dialyzed through a venous catheter, are at particular high risk for these kinds of for MRSA like infection. Hemodialysis patients with MRSA infections have longer hospitalizations, and this can incur a higher cost in context of the admission into the procedure that they may have or may require. And patients with MRSA infections often receive antibiotic treatment with glycopeptides as well. MRSA bacteremia has also been important, and it has been defined as the presence of at least one positive blood culture for MRSA in a patient with clinical signs and symptoms of sepsis. And the vascular catheter related bacteremia is diagnosed usually using clinical and microbiological sort of criteria or standard operating um, high rates of infections in patients who undergo dialysis can be attributed to infection owing to, so for example, there can be in relating to the dialysis access, there can be a white blood cell and complement dysfunction from contact with dialysis membranes, and there can be iron overload exposure to bacteria and pyrogens from contaminated dialysis water systems or inadequately cleaned dialysis machines. In context of risk factors of infection, so risk factors for infection not related to kidney replacement therapy could apply at all stages of pre-dialysis, including the causes and treatment of kidney disease, comorbidities, a reduced vaccine effectiveness, and also high levels of exposure to healthcare facilities. High levels of exposure to health care facilities, and there's works by Narayanan from 2019 that look into this. In context of peritoneal dialysis infection, so despite the progress in newer technologies and antimicrobial therapy, peritoneal dialysis related infections can still remain quite common and cause and prompt complications as well. In CKD patients generally, there's a particular infection, particular bacteria known as Clostridium difficile, and basically in patients in CKD are at higher risk of Clostridium difficile infection, which is perhaps one of the most common causes of transmissible nosocomial infections in healthcare facilities. So in context of prevention of hepatitis B virus or HBV, implementation of infection control precautions can include, for example, vaccinating against HBV, avoiding reuse of dialyzers for patients who are on forms of renal replacement therapy such as hemodialysis, and in patients who may be undergoing, for example, apart from hemodialysis, there is also other forms of dialysis, and wherein patients should not have a reuse in the same dialyzer if it can be avoided to prevent infection. And so avoiding reuse or recycled dialyzers in patients for patients who may be, for example, positive for hepatitis B surface antigen, and also where, for example, patients who are on forms of renal replacement therapy and where, for example, owing to anemia, wherein they may require a blood transfusion in some regard, and in such patients who may be susceptible for anemia, for example, screening of blood donations in context of HBV markers would be important, and generally in and around sort of the practices around transfusion. Generally most blood donations or blood donors, most blood donors nowadays are screened for to ensure that there's no risk of infection being transmitted across patients who may require blood donations. But generally, a prevention of HB virus in this context is specific, would be specific to those who may need a blood transfusion owing to the loss of blood through renal replacement therapy as well. So screening donor blood for HBV is generally an important in that regard. Renal replacement therapy patients or those undergoing forms of renal replacement therapy can be affected by multi-drug resistant organisms that have emerged as important causes of health associated infections. From a sort of collaborative effort in preventing infections, it's important to follow standard operating procedures or following best practices according to frameworks and guidelines. Improvements in any antimicrobial prescribing practices where applicable, rigorous implementation of standard infection and control measures for hygiene and aseptic handling of central venous catheters, wherein patients who may have tunnel lines or catheters as part of their vascular access